Hello, today is Sunday, July 26, 2020. It's Dr. Rhonda Johnson, and today I'm going to be talking about COVID-19 and orphaned children. This is by far one of the most difficult messages that I have ever delivered on this topic. But the reality is children could end up being the biggest victims of the COVID-19 pandemic. And the sad reality is, as this pandemic spreads, more and more children are going to be left without their parents. Now, it is a deeply sad scenario to even imagine a child becoming an orphan. Yet here, right here in the United States, we are at the epicenter of the world's COVID-19 pandemic. There are more deaths here. There are more active cases here. The curve in our country keeps going up. We're not even close to containment or mitigation of this pandemic. It is out of control. And newspapers and news stories from Los Angeles to Arizona to Michigan to New York City, there are more and more of these stories of orphan children whose parents have died from COVID-19 within minutes to hours to days and months apart from each other. And these stories are coming to light. Yes, this is happening right here in the United States, and it's also happening throughout the world. As this pandemic rages, we have to prepare ourselves for this tragic and unthinkable reality. Now, let's face it, most people, including myself, don't want to discuss death and dying, especially what parent wants to imagine that their children might end up as an orphan. Talk about a difficult conversation. But in April of this year, the Washington Post published a heartbreaking article that focused on the stress of children of healthcare workers. It turns out these children had been sent away with relatives to minimize their chance of getting COVID-19. It turned out these children had lots of anxiety related to the death of their parents because they were healthcare workers. And that included nightmares, poor school performance, stomach ache, headache, anxiety, again, all related to their fears of losing their parents to COVID-19. And sadly, the fears of these children, of these healthcare workers, are real, and probably many children whose parents aren't healthcare workers. Already, according to the Centers for Disease Control, more than 10,000 healthcare workers have tested positive for COVID-19. Amnesty International says that worldwide, over 3,000 healthcare workers have died from COVID-19, and many of these deaths are unreported. Now, to understand the plight of orphan children worldwide, probably some of the best statistics come from UNICEF, the United Nations Children's Fund. According to UNICEF, right now, there's an estimated 153 million children worldwide who are orphans. That's before COVID. That's now. Orphan children do not live a life that many of us would want for our children. They're particularly vulnerable to abuse, to neglect, and to many other hardships. Now, some do go to families that love them and care for them, but that is not always the case. Sometimes older children take them, and sometimes children drop out of college to support their younger siblings. And sometimes children end up on the street being sexually abused and end up missing and otherwise unaccounted for. I personally have seen the plight of orphan children in some of the countries that I have done mission work. We don't have to go far to look at what an epidemic can do in terms of the results on children. We only have to look at the HIV epidemic and see what happened there. At the height of the HIV epidemic in South Africa in 2005, an average of 1,000 people died every day from HIV, AIDS, and AIDS-related conditions in South Africa, leaving behind vast numbers of orphaned children. Fast forward to today, 2020, July 26, where for the last 5 days here in the United States, we've had 1,000 people die every day from COVID-19. Now, we don't know much about these people. We don't know their ages. We don't know if they're parents. We don't know if they have children. We just don't know. But one thing we do know, that if the toll of COVID continues, there's going to be more orphaned children. If the toll of COVID continues, we know that there's going to be more deaths. Experts estimate that the global toll of COVID-19 could eventually reach between 10 to 40 million people who die from this disease worldwide. And this is a much higher death toll than HIV/AIDS because COVID-19 is far more communicable. Now, that will inevitably leave many children without one or both parents or even caregivers. Who's going to care for these children when their parents are no longer here? The potential scale of this is just hard to imagine. The amount of sadness, grief, and suffering if this pandemic rages on. You know, it's enough, it should be enough to motivate each and every one of us to work hard to reduce the impact of this pandemic. And we all have to find a way to do something. As difficult as this topic is, parents, you have to start having conversations with your extended family, with your friends and loved ones, about what would happen to your children if you didn't survive. We normally have these conversations anyway, most of us parents, we do. But it's especially acute now in the face of this rapidly expanding pandemic of COVID-19. We cannot ignore the plight of orphaned children worldwide. Let's do everything we can to help orphaned children around the world and to prevent orphaned children here at home. Remember the 3 W's. Wash your hands, watch your distance, and wear your mask. If we all did that, we could do a lot more to stopping this pandemic. This is Dr. Rhonda Johnson. These views are my own. Stay alive, stay informed, and have a blessed day.